Good day, distinguished educators, students, researchers, and professionals in early childhood education. I'm welcoming you to day 31 of our 90-day structured professional series on early childhood behavior, environment, and learning. Today's topic is attention difficulties and hyperactive, understanding energy without restless leveling. I am Dr. Bashir Ali Muhammad, and this is day 31 of our 90-day structured professional series on early childhood behavior, environment, and learning. Let me begin with a question that requires caution. When a child restless, distracted, or consistently child has disorder, and not every inattentive child is lazy, but genuine attention challenges must be addressed early and professionally. Wisdom requires attention in childhood. Attention span in young children is naturally limited. A common guidance is a 5-year-old may sustain focus for about 10 to 15 minutes only, while for 6 to 7-year-old may sustain attention slightly longer than that of the 5-year-old. The expected prolonging concentration beyond developmental capacity lead to frustration. That if you keep children for longer period of time, so that will lead them to frustration. They will not understand you clearly. The attention for you will be limited. Their attention will go to somewhere. So you better sustain them at least 10 to 15 minutes. Then you bring something that will at least refresh their memory. And also, movement is biologically normal in early childhood. You allow the children to move from one place to another, but make sure that while they are moving, there is control and your eyes is on them. Energy does not equal to disorder. When the children are moving, then that is their energy. It's no disorder. However, persistent patterns of extreme inattention is what we call impulsivity. It may require structured intervention. You should not allow children to move randomly. They need a professional structure. In the professional educators, they observe patterns, not isolated incidents. How does that children are moving or interacting between or among them? The second sign that require attention from the children are some behaviors may signal attention related to challenges. One, inability to follow simple instructions repeatedly. If a child is unable to follow the instruction repeatedly, so that child is having a difficulties in some areas. The attention of teacher is needed to be there. Extreme difficulty remain seated when required. What we mean here is that when the child is remaining seated, actually there is need for you as a teacher to awakening that child up for him to at least be active. Impulse actions that disrupt others. Some they used to come with something that will disrupt other children. So that behavior also need to have a control from you as a teacher to guide them professionally. Then the frequent, as we are still talking about the children difficulties and challenges, we must not also forget their difficulty in waiting for their turns consistently. If children are not waiting for their turns to come consistently, that children are having difficulties and they used to be guided. Then the rapid mood shift with minimal trigger. If their mood is just as anything happened to them slightly, you see their mood changes. So that children, they also need to be controlled, to be observed. Then you observe, the observation over time is also critical, meaning that it is very, very much important for you to keep it up observing these children from one time, from time to time. You The diagnosis is not made casually in the classroom. What we mean here, the diagnosis, you observe them, you test them always before you throw the instruction, or before helping them or scaffolding them to understand or to say something about something. Then you have to diagnosis them. Then, however, an early identification of pattern allows timely support. The early identification of pattern, how the children are behaving, that will help you to uh, help them adjust their behaviors to become positive one. To avoid restless leveling, one serious mistake, which is casually leveling a child that is hyperactive, what we call it ADHD, without professional evaluation. We used to say that children, oh, this girl is inactive, is moron, is dull, is will no cough off, is so class will not suit her. No, you have to observe, evaluate them, or evaluate her or him professionally. Labeling without assessment creates stigma, influence peer perception, then reduce document. Professional educators document behaviors and collaborate with parents before drawing conclusion. You as a professional teacher, especially in early childhood or psychology or curriculum planner, there is need for you to collect the data, then collaborate with the parent before drawing the conclusion. Observation must precede judgment. Children deserve fairness in all we are doing. We have to treat them equally, and even the unequal, we have to treat them equally. A practical illustration for today's topic is: imagine a child who frequently leaves their seats. Behavior labeling, consider these things. Is the lesson too long? Are instructions too complex? Does the child need movement breaks? Is the environment overwhelming or overheating or overstimulating? Is sleep or nutrition a factor? If the children are feeling sleepy, or they are not to that they are in hunger, so they will not to pay attention, and they will not sit properly, they will not give you their attention as you wanted them to do. So actually their nutrition and their sleep level need to be considered and need to be observed. That is why sometimes in early childhood education we used to allow children to rest. Just let us sleep, then they will rest. Then what we should do here is the environmental adjustment. Environmental adjustment often reduces symptoms. If we can adjust this, we can carry them from the classroom and take them outside the classroom for us to go around to dance and shake. Then we go back to class. Then they will give you attention and learn actively. So, and they will participate in your lesson. And as such, if the behavior persists across sitting consistently, professional referral may be appropriate. What we mean here is that if you find it very difficult to control the behavior of some children, you have to refer them to the professional. For what? For appropriateness. Classroom strategic supporting attention. The strategies for supporting attention Effective strategies, they include shorter instruction segment, clear, concise instruction. Number 4, classroom strategy for supporting attention. The effective strategies, they include shorter instruction segment. You give the children very short instruction, clear, concise, clear and concise instruction, visual schedules, movement breaks, strategic settings. That the setting should be strategic, hands-on learning activities. The children, they need hands-on learning activities, meaning that they enjoy practical things. Positive reinforcement focus. You always give them a positive reinforcement for focus. The structure improves regulation. Children often perform better in predictable environment. Instructional style influences behavior. The way you are using the instructional style, it will also influence the behavior of the children that you are dealing with. The reflection for educators, ask yourself, are my lesson developmentally appropriate in length? Do I incorporate movement intentionally? Do I allow children to move around, impose focused behavior? Do I observe pattern carefully before reacting? Professional management is proactive, not reactive. Professional management is proactive, not reactive. Early childhood classroom must accommodate developmental energy. You can apply this in your classroom for your tomorrow lessons and see changes and wonderful. A 2-minute movement break between lessons. When you are teaching the children, try to create a break. Let allow them to move. Let allow them to at least have a rest. Do a visual reminder of expectation, a specific praise for focused behavior. If someone did good, try to praise him or her. You will see a wonderful changes. A deeper insight for today's topic: attention skills are part of executive function. They develop gradually. When trained early, academic success improve, behavior stabilize, the confidence grow. When misunderstood, children are unfairly labeled, frustration increases, relationship weaken, balanced response protects development. In conclusion for today's, energy is not an enemy. Lack of structure is often the problem. Observe carefully, support intentionally, avoid premature labels, collaborate responsibly. Tomorrow we explore another often misunderstood behavior: shyness, withdrawal, and anxiety, giving quiet children a voice. I remain Dr. Bashir Ali Muhammad. Thank you for your attention. See you on day 32.